Hello everybody, I'm Alexander Habermeyer. I'm the Chief Product Officer from Cardiomatics. It's a pleasure to be talking to you from ESC 2024 with Professor David Duncker. Professor Duncker leads the Heart Rhythm Center in Hanover, University Department of Cardiology. Thanks for chatting with us, Professor Duncker. David, let's get into it. AI is everywhere in the conversations. It's been a huge buzzword, also here at ESC. But where are we? What is the current standpoint of AI today? Is it really having an impact on daily clinical practice for many centers, or is it still more of a research topic where we're trying to understand the potential and how to use it safely?
Yeah, we see this on the Congress. Digital topics are everywhere and AI is part of that. Mm-hmm. And I think we are at the very beginning, let's say, of this journey, mm-hmm. Concerning AI specifically. Mm-hmm. But we are also already in the middle of it.
Okay.
So this seems contradictory, but I feel like we need a lot of research, and a lot of research is currently done on AI topics in all the fields of cardiology. Mm-hmm. But we are already using tools that use AI for our clinical decisions. A lot of tools that we already use partly use AI for their analysis, and this includes ECG analysis, but mm-hmm. also a lot of imaging tools analyzing the CT scans or echocardiography already have part of artificial intelligence as a component, even if we then decide on some images to take our clinical decision. And this is what I meant by we're in the middle of it. We are already using approved, FDA-approved tools mm-hmm. using AI, but we still need some research on how to implement it in the next step. So this is a growing field. We need to be to keep the momentum and be very close to it as physicians, mm-hmm. Because this is something that will definitely be part of our clinical practice in the very near future.
Great, clear. So there is still a lot to learn and a lot to develop and implement and benefits to be potentially gained, but also today there are tools that are being used in daily practice already for example, analyzing images or ECG analysis. So at Cardiomatics, on the ECG analysis side, of course, we're AI-powered approach, and we see across countries' healthcare systems there is a steady inflow or growth of the number of cardiology patients for diagnostics. It's linked to core demographic trends.
Sure.
But the supply of Professor David Dunckers is not necessarily increasing in the world.
Why not?
also because of partly demographic trends and the baby boom and so on. So what role do you think AI can play there in managing that challenge?
AI is needed to cover this need. I mean, we will have a lack of resources very soon if we are not already there. Mm-hmm. So we need to be more efficient, and obviously AI can be more efficient, faster, and can help us to cover this gap.
Yeah.
If we don't do it, we will lose patients. So we are in concrete need for AI help. Okay. And this is a chance. This is an opportunity. We can spare our own resources, mm-hmm. use AI, and then still take care of all of our patients. So I think this is very positive about this development, but of course we need to learn a lot how to implement this and to be sure that it is accurate, mm-hmm. and not trust AI because it is AI.
Yeah, of course it needs to be done in a very controlled way. It's interesting, I saw a survey recently in the US that mentioned that up to 40% of cardiologists had experienced burnout. So I think this gap in resources is...
Yeah, maybe this can also be solved by AI.
is happening, at least happening already on the resources issue side. So how do you envision the relationship between cardiologists and AI in the future? Is Is it replacing part of the job? Is it replacing the burdensome part of the job? Is it just your assistant? Is it showing you things that you would not be able to see yourself? How do you see that?
Well, I think we need to dramatically adopt, and we will need to learn completely new how to do our job. This doesn't mean we are replaced, but we will approach our tasks differently. And this needs adoption, and adoption is always tough if you think about habits and how you interpret your role. So the role of a physician and a cardiologist will change in the next years. But again, I think this is a positive way. We can be more precise in our treatments. We can also be faster, more efficient. We can identify the right patient for the right treatment using AI. And this gives us the role to validate and to be sure that this is the right pathway. But if we work on it, we can do it.
Great. Thanks so much, Professor Duncker. It's been a pleasure to connect. Thanks for sharing your insights. I'm sure they will be very helpful for the community out there.
Thank you.
Thinking about the topic. Talk soon.